it's a key decision whether to vaccinate or not, and if not, what else might you do? All of us who go one way or another are invariably trying to do the best for our children, but with different information, different backgrounds, we make different decisions. And I think for many people, the critical thing is, do we have enough information to truly be in a position to make an informed consent? What does it mean when we talk about being informed? What information do we think should be provided? And by and large, the information that is provided is way too little. Typically, when people are at the critical point of choice about deciding to vaccinate or not, assuming we're not in a part of the world where there is mandatory vaccination, they are usually told the vaccine is safe and effective. Many risks are actually concealed by authorities. In the UK, for example, it was only through a freedom of information request that it was determined that the level of adverse events that were recorded by the UK medicines licensor, the MHRA, was several times higher than any other known vaccine, with MMR being the next highest level. So there was some 8,000 adverse events, serious adverse events, that were sitting on an MHRA database that was not being communicated to the medical profession, certainly not being communicated to parents or children that were at the key point of making a decision about vaccination. Obviously, there are many people who can tolerate an enormous amount of environmental exposure to xenobiotics, to toxins. But there's a very significant proportion of people who respond adversely. Because of the increasing concern about adverse events, what we've done at ANH is actually start to look more closely at the vaccines, and we've been now acquiring samples of HPV vaccines and running through accredited laboratories tests looking at one of the adjuvants, aluminium, that may be associated with the kind of adverse events that are being seen amongst susceptible populations. The dramatic finding that we've made is that from these results, the levels that we're finding within the vaccines are significantly above the levels that are recorded with the licensing authorities. And that is of great concern for a number of reasons. What kind of arrangements are there that actually allow this kind of variation to occur? And if they can't get it right with aluminium, what else might not be in there that people don't know about? So there's some very real questions that pose an even bigger question mark over the safety and the reliability of these vaccines. HPV is effectively a sexually transmitted disease, and yet government authorities separate out HPV as a separate category. They certainly don't like to list HPV alongside syphilis, gonorrhea, even HIV/AIDS. And yet there is so much information that could be provided to families to encourage, for example, a delay in the first sexual encounters of their children. It's actually a very successful strategy. And when one looks at preventative strategies in healthcare, that kind of strategy should be front and center in terms of managing the overall rates of HPV transmission. And yet vaccination is viewed as the primary strategy, and that is just not right. In our society, we attach an enormous amount of power to the information that we get from our doctors, from our physicians. And the reality is, for people who are going to their physician to get information about the risk and benefits of vaccines, they actually are going to people who have very limited information. And that, of course, is a major problem when it comes to achieving informed consent. The information comes from particular sources linked to major health authorities like the CDC or the National Health Service in the UK. where the trials are extremely limited. Very often the assumptions being made as a result of the conclusions of these trials do not reflect the available data. What we see within the literature are very, very clear biases. Some of the biggest, most powerful and influential studies and systematic reviews and even meta-analyses have often been conducted by individuals and research groups that have very specific and often declared interests in the vaccine industry. One of the issues that is of great concern for many parents is the fact that they witness a temporal association, an association in time between the vaccination event and the development of symptoms. When they present this information to a primary care physician, they are very often told, no, it couldn't possibly be the vaccine. In the case of HPV, where you have 2 or even 3 vaccinations, what many of the purportedly vaccine-damaged children have experienced is a successively more severe reaction throughout the series. And it is quite astonishing to us that this is not taken seriously by the medical establishment. There is a huge gap in what we know about the information. One of the reasons that this film is being made is for the simple reason is that there are a lot of people out there, whether they are vaccine damaged individuals or people who believe that their children are being damaged from vaccines, or whether there are scientists working in the field, that shows that there is a major gap between what governments and what health authorities are telling us and actually what is available out there. And hopefully this film will make an important contribution to encourage health authorities and individuals to get information that allows truly informed consent to be made.